When we make decisions, we want to make decisions out of the present, not about what might happen in the future or what might have happened in the past. Best way to think about anxiety is Dan Siegel came up with a model of anxiety using your hand. So if you think about this as your ancient brain and your reptilian brain that responds to anxiety. So if the saber-toothed tiger came up, you just need to run. You don't need to think. It does three things: it fight, flee, or freeze. This bit is your gray matter that goes over it, and this is what we use in modern times. So we're not confronted with tigers. We might be confronted by the odd snake on a bushwalk, but then we respond from there. If you walk in front of a tram and it hoots, you jump. But when we deal with something like COVID, we want this bit of our brain to engage. So when we get very anxious, the brain disengages from that because it goes to the primal response. But we really want to change via the way we breathe to get the gray matter back in so we can make logical choices, we can weigh up the risk, because sometimes our anxiety runs away from us and we overestimate the risk of certain things. But if we do a couple of things I might discuss later, that you can change patterns so you can get that brain to re-engage and you can make a sensible decision about what's within your control and what might not be. The one thing that we've found that is very, very useful and recurringly very effective is that when you find you in that spot where you are just anxious and you can't really think clearly about it, is to change the way you breathe, because your body has gone into that angst response. It's gone into panic mode. So you just want it to return to a normal state of mind so you can be present in the now. We know that if you go to the future, if you fantasize about the future, it can be quite bad. If you ruminate about the past, that can be quite destructive and not good for our mental health. So we want to be present in the moment. And the way we do that is by starting to breathe in for a count of 4, hold the breath for a count of 2, and then breathe out for 6. So when you breathe out longer than in, which sounds bizarrely easy to do, your angst response will drop down and you'll go from your sort of panic response to a cognitive intact response. So if you sit an exam and you suddenly hit a blank, there's no information coming in, you think it's all gone, and you do this breathing exercise for a minute or two, you'll realize how as soon as your gray matter re-engage with that angst response, all the information will come back and blank will change and you will get the information that you stored if you studied. And I think that is one of the basic exercises that everyone can do. In 4, hold 2, out 6. And if you just do that pattern for a minute or two, you'll feel the change in you and you'll feel much more secure and based in the present. And when we make decisions, we want to make decisions out of the present, not about what might happen in the future or what might have happened in the past. We want to do it from a point where we are in control and we make the decisions based on the information we have.